There it is.
Okay.
Good morning, everyone. Welcome to admin. Andy.
All right. It looks like online we have Andrew Chorney, Cheryl Hartman, Christina Devar, Jenny Zazo, Melissa Fisher, uh, Kirsten, and MCAT. Kirsten, could I get your last name for a roll call? Okay.
Frazier, who
Muted.
may or may not be
Okay.
being appointed today.
Okay, we'll go with that. Sorry, in 206, we have Commissioners Slotnick and Vero, Allison Franz, Carrie Powers, Benny Bablish, Ann Hughes, Brenna Davis, Maddie Scott, and Kathy, Chris Lounsbury, Erica Grinde, Cindy Kennedy, Claire Buddick.
Yeah.
Biddick, yeah, thank you, Claire. Melissa Richards, and I got everybody.
Great. Thank you so much. Is there any public comment on items not on the agenda? Not seeing any. Consent agenda, the 4 items. Does anything need to be pulled out or discussed? Oh,
There is.
sorry.
Commissioners, I just want to point out, I had a late change on so this is the amendment to the benefits plan, so item 3. Minor change, but it is a substantive change for the chiropractic care. We had indicated that the definition of that would include care provided by a chiropractor and a doctor. It will just be care provided by a chiropractor. That matters because there are some medical doctors who provide care that falls in chiropractor codes. So those providers will continue to run under the general benefits plan.
Thank you.
Yes, apologies for the change.
My only comment on this consent agenda, though it's very brief, only 4 items, is testimony to the diversity things we deal with. From the Frenchtown Football Club field standardization to employee benefits to something called Avaya Sub X. Their phones.
Phone
It's
system.
just such a cool name.
Phones.
Yeah.
Who actually uses phones?
Rarely seen. I would move to pass this consent agenda.
Second, any further discussion or public comment? All in favor? Aye. Okay, it's a Claire Biddick show.
Yes, hello, my name's Claire Bennett. I'm a grants administrator. I'm here today to talk about action items 1 through 5. I did just want to highlight too, so these are all contracts for the rural grant program. And there was one contract that was on the consent agenda, so I just wanted to highlight that that is also a part of this. Yeah, just to start off, so this is the Rural Impact Grant Program. So this was created by the Missoula Board of County Commissioners to support community-driven projects that enhance the quality of life in rural areas in Missoula County. This is our 2025 impact grants. And so the first contract for item number 1 is with the citizen group Building a Better Society Community Outreach. And this contract would be for $3,740. And this project would be to host a community cleanup and flower distribution event for Sealy Lake residents.
Okay.
Yeah, it's still ball.
Do them all.
It's still ball.
Yeah.
Okay, yeah, all right, I'm ready. Okay, so item number 2, so this is a contract with Friends of Two Rivers, Inc., which they do business as the Bonner Milltown History Center. And so they are requesting funds for $2,500. And this would be to develop an exhibit that features a 2,700-pound vintage safe that was taken from the Bonner Mill. And so this safe would be at the Fennell House Brewery in Bonner because it's too heavy to be at their museum, and is also an exhibit that'll be available virtually for free through a museum app. And then item number 3, so we have a contract with Bonner PTA for $4,000. And so this project would pay for the equipment cost of a new playground and community park that's located on Bonner School grounds. Some of the plans include an updated play structure, a volleyball court, new basketball backboards, and new swings. Item number 4 is a contract with the Upper Swan Valley Historical Society for $4,000. And this project, they would be hiring a contractor to power wash and seal deteriorating exterior logs on the Lindbergh Lake log cabin. And this cabin is home to the Swan Valley Museum collections and is also an important gathering space in Condon. And then lastly, item number 5 is a contract with the Swan Mission Academics Arts Athletics Resource Team, also known as SMART. And so this contract is for $960. And they would be offering a new series of Friday clubs these are for kids in Condon, and this club would be focused on journalism and graphic design. And these clubs are hosted at the Swan Valley branch of the Missoula Public Library in Condon. Yes.
Thank you so
Yes.
much.
Yeah, thanks. Those are all such great projects.
Thanks. Yeah.
Good work. It's wonderful to see this money getting out in the community and doing this, again, more diversity stuff. So I would move we say yes to items 1 through 5.
Second, is there any discussion, or public comment, or does anyone want to shake some pom-poms for any of these projects? Okay, all in favor? Aye.
Aye. Thanks, Ben.
Yeah, thank you so much. Okay, Erica Grandy.
So before you is a request for commissioners to approve 10% increase to the medical premium rate for the employee benefits plan. And this is across all rate levels. So this would attach to the employee only rate, which Missoula County as the employer pays 100% of. It would attach to the employee dependent, so employee children plan, which is a shared cost between employer and employee, employee spouse, same thing, shared cost, and then employee family. So all of those rates would increase 10% starting July 1st. So it's for the county's fiscal year 26. So the drivers of costs, I feel like I could record myself over the last few years and tell you what the drivers are. The primary driver, again, remains pharmacy benefit spend. We continue not to be alone in this space. So on average, employers that are self-funded are seeing about a 13 to 20% increase in their pharmacy benefit spend. Continues to be pretty rapid development in that space of new pharmaceuticals that fall into this specialty pharmacy category and are just really quite expensive. It's not uncommon for our plan and other employer-funded plans to see a fair number of members receiving drugs that are in the $5,000 to $10,000 a month range. And so when you think about our premiums, that spend is shared, our premiums that go in, then share across all levels there. And so we just continue to see that we're not bringing in enough premium revenue to support those claims costs. For the first time really since I've been in this position, so 8 years, we're also starting to see our contracts with facilities, so hospital costs we're struggling to contain some of those costs in communications with our local facilities. And this isn't a surprise, I don't think, to anyone in the room or hopefully joining virtually. Our local facilities have definitely seen an increase in their personnel costs. One reported that they are spending more than 40% more in their nursing costs. And so those are certainly passed along through the claims prices and costs for services. So we've definitely seen an increase in our local spend for those facilities. And we're not able to control those quite as well as we have been in the past. We try to tie those costs back to Medicare, meaning we would pay a percentage of the Medicare costs. And when we say a percentage, these are in the hundreds of percents. So like between a 200% and a 300% of Medicare, that's a pretty good rate for a private payer, which we are in this space. And still for those facilities, they're saying that that's not meeting what they're actually paying for those services. So in some spaces, we're seeing our line costs reach up to 500 to 600% of Medicare costs. So, you know.
What was that number, the hospital increases? Sorry.
Yeah,
what
so
was
around
that?
40% for.
40%.
No.
Yeah, the nursing costs, which I think, you know, we watched some of that in the news in terms of how they were negotiating post-pandemic for those nursing wages. And so now we're just kind of seeing that filter through to our plan.
I'm sorry, no, for the percentage increase from hospitals for our plan is 40% or?
No, they're paying their personnel costs.
Right. It's 40%.
Have increased 40%.
Okay. I was
Yeah.
just trying to figure out what.
Yeah. Yep. And so some of the things we're doing, which these were on the consent agenda, but I do want to point this out. So we have sat with our plan has had the same co-insurance, meaning what we if we go to a hospital here in Missoula or we go to one that would be out of network, we would pay, the plan would pay 70% of the allowed fees. So the contracts we have with our providers here in town, if we paid $1,000 for that service and we had met our deductible, the plan would pay $700 and then the member would pay $300. Similarly, if the same service was provided at an out-of-network facility, the plan would pay $700 versus $300. In the amendments to the plan, we are reducing our out-of-network co-insurance to a 50-50. This should allow us to gain better contracts locally because there's no incentive locally to drop their fee schedules because they're saying, well, wait, you're just paying the exact same to a facility out of network. So there's that component. On the pharmacy side, again, in the amendments that were passed on the consent agenda, we have always been a plan that has really not wanted to say we require any sort of engagement in pharmacy programs. There is now a component to say we are going to require members to engage in these cost savings programs where the member has to be the applicant. So there are foundations nationwide that will essentially pay, 90% of these specialty drug costs, but the member has to apply. They won't pay them for an insurance company, but then that savings will pass through to the benefits plan and certainly will not put a member in a worse position than they otherwise would have been. Does that make sense? So there is no way engaging in those programs that we will ensure that the member share is going to be the same.
So with the increase in pharmacy costs, you're saying it's basically just around a handful of drugs that are really special that cost a whole bunch. And we have folks who are in need of those drugs, as opposed to sort of globally all the pharmaceuticals are just going up.
Right. So, 8 years ago when I came on and when we were spending about $1 million a year on pharmaceuticals, now that we spend that in 1 month,
Oh my
it
God.
can be 1 month. I mean, every week our pharmacy bill is between $80,000 and about $200,000.
So is that mostly just a handful of really expensive drugs?
It
Or
is.
is it the whole thing?
It is. It's a handful of really expensive, and we're just seeing more member usage.
Using those.
And so we've shifted from care with a provider that is, physical medicine, I guess is the best way to put it. So going into your provider, having surgeries, having like specific, or just continuing, frankly, to feel awful and trying these non-specialty medications to control chronic disease. Now we have amazing research development happening in the pharmacy world. It's just coming at a price, but it is incredibly valuable to the health and well-being and ability of our employees and their families to come to work, to live their lives and do all the things we want them to do. But yeah, so I mean, it is this handful, but they're just very expensive.
What diseases are they treating these?
They mostly fall into like inflammatory, so like rheumatoid arthritis, Crohn's,
Autoimmune diseases.
autoimmunes. Yeah, that was the word I was looking for. Thank you. Yeah.
Well, thanks for this.
Well, yes.
It
And
has to be done.
yeah, no, it has to be done.
I mean, but this is
Well-
coming nationwide, like, well, where does it go?
Well, so I mean, And we can obviously, we can continue having these conversations. I mean, I think the hard part for me is, right, so where is the control? We talk a lot in this room about the pressures that are faced by Missoula County as the local government entity, and then as Missoula County, right, as our whole community. And so doing this, you all recognize this from me, like this is a hard thing to do because I know I'm taking dollars away from doing some of the things that we could be doing out in the community. But then it's also like, is there something that can be done to start controlling some of the costs? Again, I think the pharmacy world is very opaque in terms of figuring out where all those dollars are going. To some extent, I think we're feeling some of that now, even in the facility side, right? So like, I understand that there have been increased personnel costs. I'm also struggling to understand how a local government plan of, 2,500 lives needs to bear the burden of those costs, right? So like, I think that's the challenge that I think we all should kind of start thinking through. And if there's something particularly for government plans, and that word generally, those two words together generally tied to like Medicare, Medicaid, but I mean government employer plans where there should be some cap on what you're having to pay at facilities in terms of percentage of Medicare.
That'd be a good idea.
I mean, I'll be totally honest, we do look pretty frequently and talk to members who have a Medicare, Medicaid plan and really talk to them about what is the value of also being on the county plan and that plan, because the county's always primary. Those are hard conversations to have because we certainly are not going to say you can't be with us, but at the same time, that is also potentially a cost saving measure. We just want to make sure that that individual is not losing any benefits if they were to leave our plan.
Thank you for that.
Yep.
I would move we do with this item number 6, say yes to number 6.
A second. Is there any further discussion or public comment? All in favor? Aye.
Thanks
Okay.
for doing this hard stuff. Eric.
Yeah, thank you. Something a little more positive. Here we go, Maddie.
So today I'm requesting the board appoint a member to Swan Valley Community Council. We had one applicant, Kirsten Fraser. Sorry if I say that wrong. And it would be to fill the open seat through May 31st, 2027. We heard a bunch of positive feedback about her from multiples.
We got lots of emails and letters.
Yeah.
Let's put Kirsten on this
Supporting
board.
Kirsten.
That's my motion.
Okay, second. Any further discussion or public comment? All in favor? Aye.
All right, then the second one would be for the weed control board. You met with Mary Von Hoffman. She has gone to meetings before. She seems to be very interested in being on this, and it would be for the vacant term through December 31st of 2027.
Fantastic. Let's put Mary on this board.
Second, any further discussion or public comment? Mary has a lifetime of experience. She's gonna be great.
She's going to get in the weeds.
She's gonna get in the weeds. All in favor? Aye.
Hey, Mary, can I ask you a question just because I was gone for that chunk of time? Did we put someone on the local tax appeal board, or is that yet to be done?
We have only heard back from one applicant and we did one interview.
And I feel like
That was CB.
he was a great
Yes.
interview, and they have a spot, and I would love. to
And
hear
as of last night, I came into 2 more applicants this morning, so we will be pushing that out a little bit to, I haven't looked at their applications if they're qualified yet, but that would be something I'm
mind-
doing after this.
Would you mind letting CB know
Yeah.
that this is going to be pushed out for a while
Yeah.
because of these other
Yeah, I was hoping that it was wrapped up and then I came in this morning to,
applicants?
oh, that
Wow.
Okay. and
kinda
how many
changed my
open-
plan.
How many open spots were there?
2.
Okay, great. Thank you.
Correspondence,
Well, I was
yeah.
going to read this first. Sorry.
Oh,
Thank you.
Okay.
Oh, I think I did read this already.
Yeah, it's just,
I just saw it in my top, and didn't read one once before and got smacked, so I wanted to.
Yes, yes, you guys have both seen
Read that,
this. It's just a
I've read
letter of
that letter.
support to Representative
Well written
Zinke on,
letter.
oh, yep,
Yes.
oh, thank you.
Well done. Lana.
In support of federal funding for the Sealy Sewer
Yeah.
project.
And thank you for turning around so quickly. This was such short notice, so
You bet.
thank you, thank
Rooting
you.
for this project, for Mr. Zinke to pick this project and for the federal government to pass the budget.
Yes, discussion, a legislative update.
No legislative update today.
Woo,
Nice, like it.
what's your date? When do you think it's going to be
Sign or
over?
die.
Oh, I don't think they'll be out before the middle of next week. So,
Okay.
They've tabled that no blue sky west of the mountains bill.
so far, could always be blasted.
Yeah.
Okay. Oh, we did not make it less than 10. It's 20 minutes. Okay. Have a great day, everyone.
Thank you
Take
all.
care.
Thanks.